The Association of Black Women Physicians empowers Black women to lead in health and wellness for themselves and their communities. ABWP signature support is experienced through premier educational programs, philanthropic outreach, and the distribution of academic scholarships. This nonprofit organization positively contributes to society, science, medicine, and its members. Through its network of more than 500 physicians and supporters, ABWP develops strategic collaborations with the nation's top health and wellness organizations in order to address the critical aspects of health disparities and wellness education. The tireless work of ABWP highlights their commitment to the advancement of knowledge for urban underserved communities through the healthy literacy and public health advocacy. Under the leadership of current President, Dr. Cosette Lyons-Jones, we have joined forces with community partners to address the issues of health disparities and racism as a public health crisis.
Institutional racism permeates every aspect of American society, including healthcare. Black patients experience higher rates of prejudice and mistreatment in hospitals and clinic settings, increasing their risk of adverse outcomes and even death. Vast research shows that African American patients tend to receive lower quality health services, including care for cancer, HIV, prenatal care, and preventive care. The presidential platform of ABWP was chosen in response to the widening health and health care disparities gap and the need to address racial inequities exacerbated during the current COVID-19 pandemic. The Association of Black Women Physicians has almost 4 decades of experience in this area and is poised to lead the conversation toward change.
Thanks to the efforts of immediate past President Dr. Sylvia Gates Carlisle, ABWP was awarded the David B. Rogers Foundation grant to fund our inaugural MCAT Prep program. Expanding beyond the reach of Southern California and creating a pipeline to medicine for Black men and women from schools across the country. ABWP provided an intense academic and culturally competent MCAT Prep program to 53 deserving Black students.
The Medical College Admissions Test, MCAT, is the first of many required standardized tests over a physician's professional journey. It requires synthesis of acquired knowledge and helps medical schools assess problem solving and critical thinking. The MCAT, steps 1 through 3, and the specialty boards represent high stakes and can intimidate strong students. Through a large grant, the Association of Black Women Physicians provided a rigorous 8-week MCAT prep program to 54 male and female pre-meds from 26 states, supplementing our traditional portfolio. Through our annual charity benefit and mentoring, ABWP materially supports the development of a diverse physician workforce.
Thanks to the efforts of Drs. Anna Lopes-Johnson and Renee M. Poole, ABWP has been awarded the community grant through Gilead Sciences to provide community education about HIV STDs and PrEP, pre-exposure prophylaxis, which can successfully prevent HIV. ABWP continues to endorse the Healthier Traditions Soul Food Cookbook, developed in collaboration with the Trans-America Institute, a nonprofit private foundation. It features 19 Southern-style recipes with suggested healthier substitutions. ABWP's health initiatives address healthcare disparities, including hypertension, heart disease, obesity, diabetes, HIV, and cancer. ABWP focuses its efforts through 4 signature programs. The Sister to Sister Mentoring Program matches medical students with physicians to cultivate and encourage the students' successes and providing them early access to the communities they will ultimately serve. The Speakers Bureau provides the expertise of physicians of various medical specialties to community organizations for their health-based programs and activities. The annual Charity and Scholarship Benefit raises money for community service program activities, and provides deserving medical students with scholarship awards. The Community Advocacy and Education Committee promotes public health initiatives. In response to the COVID-19 pandemic, ABWP members have been on the front lines treating patients, educating healthcare professionals, and the communities we serve through webinars, CME offerings, and community service spanning beyond our reach of Southern California. During the initial rollout of the vaccine, ABWP volunteered with Watts Healthcare Clinic and Kaiser Downey to support the vaccine administration efforts and address vaccine hesitancy. ABWP cares about the issues that affect women, African Americans, and other traditionally underrepresented minorities. That is why, with nearly 40 years of volunteer service, we lead with passion and purpose. Standing up for health and racial equity, educating the community, reducing healthcare disparities, and being a source of inspiration and encouragement to future physicians, ABWP answers the call of making a difference in the lives of others. We are the Association of Black Women Physicians.